Hello everyone. I was born in North Korea and lived there for many years as an expat. When discussing life inside the socialist hermit kingdom, North Korea's so-called free healthcare system is almost always mentioned. But what are the actual conditions of this system? How do ordinary North Koreans access medical treatment when they get sick? In other words, how does North Korea's free healthcare system really function in practice? One claim, often repeated by North Korean sympathizers and official state media alike, is that the country provides universal, free healthcare to all its citizens. It's a boast that paints the regime as benevolent and self-reliant, a socialist ideal in practice. But behind that polished facade lies a much starker reality, one that few truly understand unless they've lived through it. What does free healthcare really mean in a country crippled by poverty, isolated from the global medical community, and chronically short on even the most basic supplies? In this deep dive, we'll strip away the propaganda to examine what healthcare in North Korea actually looks like, from the structure of its hospitals and the shortage of trained doctors, to the underground world of home-based treatments and the widespread reliance on traditional herbal medicine. Drawing from lived experience, we'll expose a system where diseases are endured rather than cured, and where access to care is often determined not by need, but by money, location, and connections. This isn't the story of a failed policy. It's the story of everyday survival in a nation where even getting sick can be a life sentence. First and foremost, I believe the two most critical components of any healthcare system are access to modern medical equipment and the presence of doctors who have either received formal medical education or acquired extensive experience through years of practice. Naturally, the doctor-to-patient ratio also plays a significant role in determining the system's overall effectiveness. In North Korea, patients are seen at general hospitals, capable of treating a wide range of medical conditions, are the standard. Their size and capabilities are determined by administrative divisions. Outside of Pyongyang, each province has a provincial hospital, each county has a county hospital, and most districts are served by district hospitals. Beyond this, there are no more localized medical facilities. Administratively, North Korea is divided into 9 provinces. A provincial hospital in North Korea is roughly equivalent to a university teaching hospital in a major U.S. city, often equipped with a Level 1 trauma center and comprehensive medical services. It has all the bells and whistles. County hospitals resemble smaller community hospitals. They typically include emergency rooms and inpatient wards, but may lack some specialized departments. District hospitals are more similar to rural hospitals in the U.S., operating with limited resources, equipment, and staff. Unfortunately, many rural areas in North Korea lack any hospital altogether. Does that make things clearer? There's no denying that North Korea has implemented a system of universal free healthcare. The real issue, however, lies in its inability to sustain that system. Since the 1990s, the country has faced chronic shortages of medicine. For instance, when my father was hospitalized during that time, only about 1/3 of his prescribed medications were provided free of charge. The rest had to be purchased out of pocket. Within just a few years, hospitals had almost completely run out of medicine. Over time, the system shifted to a new process. Patients would visit the hospital for a diagnosis. Doctors would write a prescription, and the patients were then responsible for purchasing the medication themselves. After obtaining the medicine, they would return to the hospital to have it administered. Whether this still qualifies as free healthcare is ultimately up to you to decide. The bigger issue in North Korea is that even having money doesn't guarantee access to medicine. For minor illnesses, people typically visit local clinics or district hospitals. In more serious cases, patients are referred to provincial-level hospitals, which are better equipped to handle complex conditions. But even at that level, medication remains scarce. Due to persistent shortages, basic surgical tools like scalpels, scissors, and forceps are repeatedly sterilized and reused. In my view, even provincial-level hospitals fall far below the standards of care that most people in the outside world would consider acceptable. This routine reuse of surgical tools, something that would be unthinkable in most developed countries, was simply accepted as normal in North Korea. I still remember watching hospital staff boil metal instruments in battered aluminum pots, then dry them on worn-out towels. There was no proper sterilization equipment, no sealed packaging, and certainly no disposable alternatives. And yet, these very tools were used on patient after patient, sometimes on the same day. Infections were common, but rarely addressed, because antibiotics were even harder to come by than scalpels. To outsiders, this might sound shocking, but within North Korea, it's just part of daily life. Even in so-called provincial hospitals, which the government touts as centers of advanced care, the infrastructure is decades behind. Flickering lights, outdated X-ray machines, and broken ultrasound units are the norm. Often, power outages interrupt surgeries mid-operation. Clean linens are scarce. Running water isn't guaranteed. In some wards, patients bring their own blankets, their own food, and even their own buckets to use as toilets. So when I say these hospitals fall below international standards, I don't mean they're understaffed or a bit outdated. I mean they are barely functional. What passes for a hospital in North Korea would be condemned in most other parts of the world. And yet, for millions of people, it is the only hope they have. That's the most painful part. The knowledge that even with all its flaws, this broken system is still the only option. I also noticed each hospital has only a limited number of rooms. But why are so many beds always vacant? This question puzzled me for a long time. Do North Koreans simply fall ill less often? If patients are required to buy their own medicine, but hospital beds and surgeries are still provided for free, why aren't more people getting hospitalized? Eventually, I came to understand the reason. For most families, the cost of traveling to a major hospital and the added burden of having a family member accompany the patient is simply too high. In cases of sudden illness, especially outside of Pyongyang, there's virtually no emergency response system. Rural areas have no ambulances, and many households don't even have telephones to call for help. For most people, the reality is grim. Minor illnesses are often left untreated, while major illnesses are both unaffordable and incurable. It's a system where disease isn't truly treated, only endured. Even childbirth frequently takes place at home. I myself was born at home. In the outside world, when someone collapses or shows signs of a heart attack, people instinctively call for an ambulance. But in North Korea, that's not an option. There's no number to call, no dispatcher waiting to send help. And in most rural areas, not even a vehicle designated for emergencies exists. When someone in our neighborhood suddenly fell ill, whether from stroke, seizure, or injury, the first response wasn't to seek medical help, but to panic and gather neighbors. People would rush to find a bicycle or carry the patient in a blanket. Hours could pass before reaching the nearest hospital, and by then, it was often too late. The lack of telephones in most homes only worsened the situation. We relied on word of mouth or sent children running from house to house to look for someone with a working landline. Even then, help rarely came in time. To this day, I carry the memory of an elderly neighbor who died because we couldn't get him to a doctor fast enough. He had collapsed at night, and with no vehicle and no way to contact anyone, we simply waited. We sat by his side with boiled water and cloths, powerless, hoping he would wake up. He didn't. What haunts me most is that his death, like so many others, wasn't from some untreatable disease or catastrophic injury. It was from the system's total inability to respond when it mattered most. That's something people who admire North Korea's self-reliance don't seem to grasp. In a true emergency, the state isn't there. You're on your own. Now let's talk about what it's like to attend medical school in North Korea. With constant food shortages, who truly has the energy to focus on studying? Outside of Pyongyang Medical University, students at other medical schools are frequently mobilized for rural labor, often sent to nearby farms to work. Skipping these assignments isn't really an option, unless you're both willing and able to pay a bribe. These constant distractions leave little time for actual study. How can a country that claims to value public health so highly afford to waste the precious time of its future doctors pulling weeds or harvesting corn? These labor assignments aren't occasional interruptions. They're regular, often mandatory obligations that eat away at weeks or even months of the academic calendar. I remember seeing students trudging back from the fields, their faces sunburnt, their hands blistered, and their uniforms soaked in sweat. After a full day of farm work, how can anyone be expected to open a textbook and absorb complex subjects like anatomy or pharmacology? Studying medicine requires focus, consistency, and rigorous academic training. But in North Korea, it often feels like those fundamentals are treated as luxuries, not necessities. And it's not just medical schools. Students at other universities across North Korea are also routinely sent to work on farms. Among our neighbors, Some had graduated from medical schools across the country, yet their skill levels were, frankly, underwhelming. Some didn't even know which medications couldn't be mixed, or had only a vague understanding of basic human anatomy, like the placement of internal organs. Without sufficient resources, universities simply can't produce high-caliber professionals, especially given that medical training in North Korea is significantly shorter than in most other countries. Outside of Pyongyang, aside from doctors who've been exiled there for offending the regime, most physicians are woefully underqualified. That's why, in our area, most people only go to hospitals for injections. For everything else, they rely on an unlicensed but experienced nurse, including our own family. For a small fee, she would come to our home to help. Thanks to her extensive clinical experience, this elderly nurse handles everything, from delivering babies to preparing the deceased for funerals. She mixes medications, performs minor surgeries, practices acupuncture and cupping, and even prescribes herbal remedies. She does it all. Once, when I had food poisoning, with stomach cramps, vomiting, diarrhea, and dizziness, she came over, listened to my abdomen with a stethoscope, and then applied firm pressure to specific acupoints. Within a minute, my stomach started gurgling. She then prepared a 500 ml IV drip, using a slightly yellowed 2-year expired bottle we had found in storage. After the infusion, I felt completely fine. Since our family once ran a small business selling medications, we interacted with her frequently. On one visit to her home, I noticed that her small private bed was crowded with patients. As we chatted, a woman entered with her young child and politely asked if they could be seen. They waited quietly in a corner. When their turn came, I realized the nurse was about to perform surgery, right there in her home. The child had fluid or pus in the chest that needed to be drained. In a dim, cramped room crowded with onlookers, the nurse inspected a scalpel she had just sterilized in a kitchen pot, muttering that her husband had forgotten to sharpen it. The child, embarrassed by the crowd, hesitated to remove his shirt, but obeyed her sharp command. The room fell silent as she made the first incision. The child was lying on the bed with his eyes tightly shut. He barely made a sound as the blade cut into his thin, rib-protruding chest. Many turned away, only to glance back. Both horrified and captivated, the nurse inserted what looked like tubes into the wound, packed it with dressing, and stitched it up, all without anesthesia. The child never screamed, earning quiet admiration from those watching for his incredible bravery. Afterward, the mother gently cradled her dazed child, her tears falling onto the bed like raindrops. The room was silent. Everyone was moved. She thanked the nurse softly, then whispered that she would pay after the autumn harvest. Put yourself in their shoes. What would you be thinking, sitting there in that room? To those who romanticize North Korea's free healthcare, is this truly the system you'd want for yourself or your loved ones? Traditional herbal medicine is also widely used in North Korea. Acupuncture and cupping are common practices, even among non-professionals, though not without risks. Often, people turn to traditional remedies not out of preference, but because of chronic shortages of antibiotics and painkillers. That's not to say herbal medicine is entirely ineffective, but in my experience, only a few remedies actually work, and the results tend to be slow and inconsistent. Even during the recent COVID outbreak, North Korea's relatively capable traditional herbal medicine practitioners were unable to curb transmission or significantly aid patient recovery. At the same time, medicines donated by the UN and Red Cross often ended up on the black market. Vaccines remained free, but as I mentioned earlier, North Korean hospitals have begun introducing various fees, signaling the quiet but definitive end of the country's so-called free healthcare system. On paper, North Korea's healthcare system may appear to be a model of socialist equality, universal, accessible, and free for all, but in practice, it is a hollow promise. Behind the regime's claims lies a crumbling system where medicine is scarce, hospitals are under-equipped, and professional medical training is deeply compromised. For most citizens, especially those outside of Pyongyang, healthcare is neither free nor truly accessible. It is a system where getting sick means navigating a maze of financial hardship, logistical impossibility, and medical uncertainty. What remains is a network of improvisation, where experienced nurses become the backbone of community care, expired drugs are given out of necessity, and surgeries happen in bedrooms, without anesthesia, under flickering lights. Traditional medicine fills the void where modern treatments should exist, not out of cultural preference, but because there is often no alternative. The tragedy is not just in the system's failure, but in how deeply normalized that failure has become. North Koreans endure their illnesses quietly, with resilience born of desperation. And while the outside world debates ideology, real people inside the country are left to suffer in silence, too poor to buy medicine, too far to reach a hospital, and too voiceless to be heard. So the next time someone praises North Korea's free healthcare, ask them, free for whom and at what cost? Because for millions, the cost is paid not in money, but in pain, loss, and the quiet erosion of human dignity. If you enjoyed this video, hit that subscribe button and leave a comment down below. I'll be sharing more shocking videos about real life inside the Hermit Kingdom.